Welcome to the new video MCQs on Parasitology Part 3. Question number 1. Which parasite is best diagnosed by finding microfilariae showing nocturnal periodicity in peripheral blood? Loa, Wuchereria bancrofti, Onchocerca volvulus, Manzanella. The right answer is option B, Wuchereria bancrofti. Wuchereria bancrofti microfilariae circulates in blood at night. This matches the night-biting mosquito transmission pattern. Question number 2. The infective stage of Babesia that enters human red blood cells is sporozoite, trophozoite, gametocyte, merozoite. The right answer is option A, sporozoite. Babesia sporozoites are injected by ixodes ticks. They directly invade red blood cells. Question number 3. Which parasite causes oriental sore? Leishmania brasiliensis, Leishmania donovani, Leishmania tropica, Trypanosoma cruzi. The right answer is option C, Leishmania tropica. Leishmania tropica causes cutaneous leishmaniasis. Lesions are typically localized skin ulcers. Question number 4. The infective form of Echinococcus for humans is proglottid, egg, cysticercus, hydatid cyst. The right answer is option B, egg. Humans ingest eggs from dog feces. Larvae then form hydatid cyst in organs. Question number 5. Which parasite is commonly transmitted through blood transfusion and organ transplant? Giardia lamblia, Fasciola hepatica, Entamoeba histolytica, Trypanosoma cruzi. The right answer is option D, Trypanosoma cruzi. Trypanosoma can spread through contaminated blood products. It causes chronic Chagas cardiomyopathy. Question number 6. The diagnostic stage of Balantidium coli in stool is usually the sporozoite, trophozoite, cyst, skid zone. The right answer is option C, cyst. Cysts are the infective and diagnostic stage. They survive outside the host in moist environment. Question number 7. Which parasite is known for causing sago-spleen in chronic infection? Schistosoma manzoni, Plasmodium vivax, Leishmania donovani, Trypanosoma brucei. The right answer is option A, Schistosoma manzoni. Chronic schistosomiasis causes periportal fibrosis. This leads to portal hypertension and splenomegaly. Question number 8. Which helminth infection is acquired by eating raw freshwater crabs? Clonorchis sinensis, Paragonimus westermanni, Fasciolopsis busci, Heterophyes. The right answer is option B, Paragonimus westermanni. Metacercariae in crabs infect humans. The parasite primarily affects the lungs. Question number 9. Which parasite shows a characteristic double chromatin dot in cyst? Giardia lamblia, Entamoeba coli, Entamoeba histolytica, Iodamoeba buchli. The right answer is option A, Giardia lamblia. Giardia cysts have multiple nuclei with central karyosomes. Question number 10. Which parasite is transmitted by ingestion of ants containing metacercariae? Fasciola hepatica, Paragonimus westermanni, Clonorchis sinensis, Dicrocelium dendriticum. The right answer is option D, Dicrocelium dendriticum. Lancet fluke uses ants as second intermediate host. Humans ingest infected ants on vegetation. Question number 11. Which parasite infection may lead to chyluria? Loa, Brugia malai, Wuchereria bancrofti, Onchocerca volvulus. The right answer is option C, Wuchereria bancrofti. Lymphatic obstruction causes leakage of lymph into urine. This gives a milky appearance to urine. Question number 12. Which protozoan parasite lacks a cyst stage? Giardia lamblia, Trichomonas vaginalis, Entamoeba histolytica, Balantidium coli. The right answer is option B, Trichomonas vaginalis. Trichomonas vaginalis exist only as trophozoites. Transmission is mainly through sexual contact. Question number 13. The infective stage of Hymenolipus nana is egg, cysticercoid, proglotid, oncosphere. The right answer is option A, eggs. Eggs are directly infective to humans. Auto-infection helps maintain chronic infection. Question number 14. Which parasite causes Mazzotto reaction after treatment? Lualua, Wuchereria bancrofti, Onchocerca volvulus, Brugia malai. The right answer is option C, Onchocerca volvulus. Rapid death of microfilariae triggers intense inflammatory response. It occurs after ivermectin therapy. Question number 15. Which parasite produces strawberry cervix appearance? Candida albicans, Trichomonas vaginalis, Chlamydia trachomatis, Gardnerella vaginalis. The right answer is option B, Trichomonas vaginalis. Cervical petechiae, often called as strawberry cervix, is a characteristic of trichomoniasis. It is seen on speculum examination. Question number 16. Which parasite is detected using Knott's concentration technique? Giardia lamblia, Plasmodium falciparum, Microfilariae, Entamoeba histolytica. The right answer is option C, Microfilariae. This method concentrates microfilariae from blood. It is useful in diagnosing filarial infections. Question number 17. Which parasite is known to cause myocarditis in the acute phase? Toxoplasma gondii, Leishmania tropica, Babesia microti, Trypanosoma cruzi. The right answer is option D, Trypanosoma cruzi. Acute Chagas disease can involve heart missile. This may lead to arrhythmias and heart failures. Question number 18. Which parasite is transmitted by ingestion of raw fish containing plerocercoid larvae? Taenia saginata, Diphyllobothrium latum, Echinococcus granulosus, Hymenolipus nana. The right answer is option B, Diphyllobothrium latum. Fish tapeworm larvae develops into adults in the intestine. It is common in areas where raw fish is consumed. Question number 19. Which parasite infection shows eosinophilic meningitis? Taenia solium, Schistosoma mansoni, Trichinella spiralis, Angiostrongylus cantonensis. The right answer is option D, Angiostrongylus cantonensis. Rat lungworm larvae migrates to central nervous system. It causes eosinophil-rich CSF inflammation. Question number 20. Which parasite is best visualized using modified acid-fast stain? Giardia lamblia, Entamoeba histolytica, Cryptosporidium parvum, Trichomonas vaginalis. The right answer is option C, Cryptosporidium parvum. Oocysts appear as red spherical bodies. This stain is useful in diarrheal disease diagnosis. Question number 21. Which parasite has a life cycle involving two intermediate hosts, snail and fish? Clonorchis sinensis, Fasciola hepatica, Schistosoma hematobium, Paragonimus westermanni. The right answer is option A, Clonorchis sinensis. First host is snail, second is freshwater fish. Humans get infected by eating raw fish. Question number 22. Which parasite is diagnosed by finding charcoal-laden crystals in stool? Giardia lamblia, Entamoeba coli, hookworm, Strongyloides stercoralis. The right answer is option D, Strongyloides stercoralis. These crystals arise from eosinophil breakdown. They are seen in parasitic infections with tissue invasion. Question number 23. Which parasite causes intestinal obstruction due to heavy worm load? Enterobius vermicularis, Trichuris trichura, Ascaris lumbricoides, hookworm. The right answer is option C, Ascaris lumbricoides. Large adult worms can block the intestinal lumen. Question number 24. Which parasite causes nodules in subcutaneous tissues called onchocercomas? Lualua, Onchocerca volvulus, Brugia malai, Wuchereria bancrofti. The right answer is option B, Onchocerca volvulus. Adult worms reside in fibrous nodules. Question number 25. Which parasite causes hemoglobin known as red water fever? Babesia microti, Plasmodium vivax, Leishmania donovani, Trypanosoma brucei. The right answer is option A, Babesia microti. Babesia infections destroy red blood cells causing intravascular hemolysis. Hemoglobin appears in urine. Question number 26. Which parasite shows an undulating membrane on microscopy? Giardia lamblia, Trichomonas vaginalis, Trypanosoma brucei, Leishmania donovani. The right answer is option C, Trypanosoma brucei. Trypanosomes have a flagellum attached along the body. This creates a visible undulating membrane. Question number 27. Which parasite infection is associated with hepatobiliary cholangiocarcinoma? Fasciola hepatica, Clonorchis sinensis, Schistosoma mansoni, Paragonimus westermanni. The right answer is option B, Clonorchis sinensis. Chronic biliary irritation leads to malignancy. Question number 28. Which parasite causes sandfly fever like skin ulcers but spares mucosa? Leishmania major, Leishmania brasiliensis, Leishmania donovani, Leishmania mexicana. The right answer is option A, Leishmania major. Leishmania major causes old world cutaneous lesions. Mucosal involvement is uncommon. Question number 29. Which parasite is transmitted transplacentally causing congenital infection? Giardia lamblia, Toxoplasma gondii, Entamoeba histolytica, Balantidium coli. The right answer is option B, Toxoplasma gondii. Tachyozoids cross the placenta during acute maternal infection. It can cause severe fetal abnormalities. Question number 30. Which parasite infection shows serpiginous tracts on the skin of feet? Lualua, Strongyloids stercoralis, Trichinella spiralis, Ancylostoma brasiliensis. The right answer is option D, Ancylostoma brasiliensis. Larval migration in epidermis causes winding tracts. It is common after walking barefoot on beaches. Thank you for watching the video. Subscribe to the channel to practice more MCQs on microbiology.